In this video, I'll break down what really causes osteoarthritis, the hidden risk factors, how they work inside your body, and most importantly, what you can do to prevent and protect your joints from having osteoarthritis. Let's start with the biggest misconception. Point 1. Age isn't the only cause. Most people think osteoarthritis is just a disease of the old. But that's not entirely true. I have seen patients in their 30s and 40s with significant joint damage. So age increases your risk, but it is not the cause. What really happens is that over time, cartilage, which is a smooth rubbery tissue that cushions your joints, become less resilient. But the speed of the wear and tear will depend on your lifestyle, your weight, injuries you've had in the past, and even your genes. So yes, aging matters, but it is really what we do during those years that really shapes the outcome. Point 2. Joint injuries and overuse. Your joints have an incredible memory. Every fall, every twist, and even sports injury will leave a mark. If you have ever torn a ligament, had a fracture of a joint, or played a high-impact sports, your risk for osteoarthritis increases significantly later in life. Why? Because the joint mechanics never go back to 100%. Proper rehab after injuries is very essential. It doesn't just heal the muscles, it protects your joints from future injuries. Point 3 is weight and pressure on the joints. One of the biggest modifiable risk factors is your weight. Every extra kilo that you carry puts 4 times more force on your knee joints with every step. That means that even small weight gain over time adds mechanical stress. But the opposite is also true. Every small weight loss can dramatically reduce pain and slow progression. So staying active and eating mindfully aren't just for your osteoarthritis. The word sounds scary, but let's simplify it. It is the most common form of arthritis that happens when the protective cushion inside your joints starts to wear down. Heart health. There are joint saving strategies. Point 4. Genetics and family history. Osteoarthritis can also run in the families. If your parents or siblings have it, you may have inherited certain genes that affect how your cartilage repairs itself. But genetics only load the gun. Your choices will pull the trigger. Knowing your family history gives you the power to act early through exercise, joint-friendly diet, and weight control. Point 5. Weak muscles and sedentary lifestyle. Strong muscles act like shock absorbers of your joints. When your muscles become weak, especially around the hip and the knee joints, more pressure goes straight to the cartilage. And when we sit for long hours or skip activities, the muscles weaken faster. To fix this, engage in gentle, regular movements like walking, swimming, cycling, or physio. Motion keeps your joints nourished and reduces stiffness, and even tells your brain to keep producing the joint protective fluids. Point 6. Inflammation and metabolic factors. Here is something newer research has shown. Inflammation plays a bigger role than we once thought. Conditions like diabetes and metabolic syndrome can accelerate cartilage breakdown. So managing your blood pressure and eating anti-inflammatory foods like fish and leafy greens can actually slow the disease process. Point 7. Gender and hormonal factors. Osteoarthritis affects women more than men, especially after menopause. That's because estrogen helps protect the joint cartilage. And when the levels drop, especially after menopause, the joints lose some of that protection. That's why lifestyle changes, maintaining muscle strength, and balanced hormones are very important, especially for women approaching midlife. So let's recap. Osteoarthritis isn't just about getting old. It is shaped by injuries, weight, muscle strength, inflammation, and even family history. The good news is that most of these risk factors are modifiable. Every healthy meal, every short walk, and every stretch is a message to your joints that you are protecting them. Remember, your joints can age, but you can always help them age well.